Hello, everyone, and welcome to the second in a series of webinars created by the Protect Better campaign, examining changes to our radiation standards that are proposed by the U.S. Nuclear Regulatory Commission. The first webinar was August 12, and we will put a link in the chat to that webinar during this webinar. It was recorded, so that's what the link will go to. Our third webinar will be hosted next Wednesday, August 26th, from 8 to 9:30 p.m. Eastern Time. I want to take a moment to thank Heal Utah for hosting this webinar and providing the technical support. My name is Cindy Folkers. I'm Radiation and Health Hazard Specialist with Beyond Nuclear. We were founded in 2007 to work for a world free from nuclear power and nuclear weapons. We are one of the many organizations that are part of the Coalition to Stop Radioactive Pollution, which brings together nonprofit organizations and individuals committed to ensuring the highest health and environmental protection standards for nuclear energy and ionizing radiation. The coalition established their Protect Better campaign, which Alfred mentioned, to push back against the Nuclear Regulatory Commission's attempt to weaken its radiation standards in order to expedite construction of nuclear-powered data centers and more nuclear weapons and reactors across the U.S. You can visit the campaign's website at protectbetter.org. The NRC is currently proposing significant changes to longstanding radiation protection standards. These may sound technical, but the implications are very real. How much radiation workers and communities can be exposed to, how radiation risks are evaluated, and how well we protect public health now and for generations to come. So tonight, our experts will help us understand what is being proposed, what the science tells us about the potential health consequences, the legal and regulatory implications, and what these changes could mean for communities and workers. Most importantly, we'll talk about what you can do. The public comment deadline is August 31st, so there is still time to make your voice heard. We will take your questions for our panel. Please put the questions in the chat. And please be aware that Dr. Alwadi will be taking questions after his presentation because he needs to leave this webinar early. Thank you, Dr. Alwadi. The remaining two speakers will present subsequently. So we have an outstanding panel tonight, and I'm grateful for each of them for them to share their expertise, and I'm excited to have them here tonight. Our first speaker is Yazan Alwadi, Doctor of Philosophy, Postdoctoral Research Fellow in the Department of Environmental Health at the Harvard T.H. Chan School of Public Health, and one of the authors of National Analysis of Cancer Mortality and Proximity to Nuclear Power Plants in the United States, published in February 2026. His research focuses on the health impacts of nuclear power, fracking, climate change, air pollution, extreme weather events, and temperature variability, and occupational exposures. Our next speaker is Dr. C.A. Forte, a scientist in the Global Security Program specializing in environmental toxicology and epidemiology. Their research focuses on the health and well-being of communities affected by nuclear weapon mining, exposure, and the threat of exposure. Dr. Forte has a PhD in environmental health sciences and a second PhD in scientific computing from the University of Michigan, Ann Arbor. Prior to pursuing their doctorate, they earned a master's degree in public health from the University of Georgia with a focus on epidemiology and biostatistics. They also worked at the U.S. Navy and Marine Corps as a deployment health epidemiologist. And then our last speaker will be Diane Dorigo, Radioactive Waste Project Director at Nuclear Information and Resource Service. Her main area of expertise is radioactive waste and environmental studies and work experience. She has a degree in chemistry and environmental studies and work experience in analytical chemistry and biological research, and she has been with NIRS since 1986. So let's begin. Let's get into the weeds. I will turn this over to Dr. Alwadi. Welcome.
Thank you so much for this warm introduction, Cynthia. I'll start sharing my slides now. Can you see my screen? Is my screen visible?
Yes.
Okay, perfect. Thank you everybody for having me today, and thank you for listening to what I have to say. Today I'm going to be discussing the recent 4 papers by our group investigating the health outcomes association with proximity to nuclear power plants, and the very recent replication of our findings by a group in South Korea. So to put this work into perspective and to understand how environmental epidemiology works and how the natural progression of studies works from an ecological level to an individual level to finally establishing causality and moving into policy, we need to remember, like, we all know at this point that air pollution is harmful, but we didn't always know that. That wasn't always the case. It all started with the landmark paper in the 1970 by Lev and Siskin. They did a cross-sectional analysis. It was an ecological study. They also received a lot of criticism that this does not establish causality. There was no individual level exposure assessment, but this is how science works, or how you get funding for environmental epidemiology studies. We can't just simply, we don't have unlimited resources, so we can't just go and start doing individual level cohort studies without having evidence at a basic level or ecological level that convinces the funding agencies that this is a question worth pursuing. And this is where this work sits. All these 5 papers sit at the beginning of this investigation to show that there is an association. There is an association with proximity. There's a spatial association between various health outcomes and proximity to nuclear power plants that will serve as an evidence for all the coming proposals that investigates the deeper to reach into understanding what factors might be leading or forcing these associations to appear. So what happened for PM 2.5? It's all started with ecological designs in the 1970. By the 1993, we had the Harvard Six Cities big paper that was published in New England Journal of Medicine, which was a cohort study. And then we moved from there into individual and different pathways of exposure, and finally establishing causality and affecting policy. Now, why does this question matter? We know that 145 million people live within 100 kilometers of US nuclear power plants. 40 million live within 25 kilometers approximately. And this is why this question matters. Even if the impacts were, or the hypothesized impacts were potentially small, the number of affected people may result in huge health outcomes or health effects. Why is this question still unsettled? There are a lot of studies on this topic that has been done earlier, investigating this association, and the picture that emerges is one of heterogeneity. We do not always get the same findings from all the studies. Some of them show associations, some fail to do so. Why we think that happens? Most of the earlier research relied on binary exposure. So they decided an arbitrary radius, like 25 kilometers, for example, from nuclear power plants, and said we'll consider everyone within these 25 kilometers or miles to be exposed, and anybody outside this radius to be unexposed, which reduces the statistical power to detect effect sizes if they truly existed. Most of them also relied on analysis around single facilities, which is, again, reduces the statistical power. They either did short or cross-sectional designs, or they had inconsistent adjustment controlling for different types of factors in each study, which makes the comparison across study really difficult. So what did we do in this series of studies, the 4 studies that our group did and the study that was done in South Korea? We took proximity as a continuous metric. Instead of arbitrarily designing a radius to take in as exposed or unexposed, we summed 1 over the distance from each nuclear power plant, so that we overcome 2 limitations. One, areas that are between 2 plants are not treated as areas that are within range of 1 plant. And the second, we do not have an artificial cutoff that's imposed in the exposure gradient. We need to be very clear, this is not a dose estimate. This is a first level analysis. No radiation measurement, effluent release data, dispersion modeling, or dosimetry at any of these studies. The question that we ask is, are cancer rates or health outcomes associated with closer proximity to nuclear power plants, regardless of how these effects may happen, or like what is the exposure pathway that they take? We have consistent adjustment across all of these studies. Same covariate sets, PM 2.5, temperature, humidity, smoking, PMI, income and poverty, education, renting, racial composition, population density, and healthcare access. We controlled for years as fixed effects, and we had consistent inference across all of them. We did use generalized estimating equations. This is a little bit more technical, but we wanted all the studies to have similar frameworks so the results can be directly compared. And the findings from all these results were stress tested. We changed exposure radii from 80 to 200 inclusion, in 80 to 200 kilometers. So the results are not artifacts of arbitrary chosen radiuses or values or parameters of our modeling. We changed the averaging exposure window from 1 to 25 years across the 5 papers, and the estimates remained stable. The evidence-based, as we said, we have the first 4 papers by our group. One investigated all cancer mortalities. The second investigated lung, breast, and colon cancer mortality. These 3 were chosen because they were the cancers with the highest mortality numbers. So choices were not made based on results. The choices were made a priori because these had the highest number of cases. Cancer incident, then we investigated cancer incidence at the zip code level instead of cancer mortality, because not all cancers are fatal and not all of them lead to death. Not all of them have the same fatality rate, and not all of them lead to death soon after they are detected. Then we investigated all-cause mortality to see whether these patterns hold when we look, or whether some of these hypothesized associations and effects exist outside of cancer. For the South Korea paper, they investigated cancer incidence. This is an independent team. They had their own data, and they used our same methods, and they replicated the results. And study 1, we did all cancer mortality in the United States. These are the age groups, as you see on the left, and this is the estimate from the model. As you can see, most of the age groups were significantly associated, positively significantly associated with proximity. Then we asked the question, does this pattern appear at specific cancer sites? So the natural selection was to select cancer sites with the highest numbers to preserve as much statistical power as we can. And we saw that they were significantly associated with lung, breast, and colon cancers. 3 checks we ran for this. We looked at negative outcome controls. We asked the question whether these associations exist if we put like accidental deaths instead of cancers, to see if is the model specific. Is there a model specificity to cancers and these cancerous outcomes? And we found no associations. We did leave K out sampling. So out of the approximately 2,000 counties included in that study, we removed 200 at random and repeated the models 100 times. And the estimates remained closely clustered. We checked for reactor technology effects, and we saw that reactor type was not significant predictor of cancer mortality. Then at cancer incidence, at the zip code scale, we wanted to change the geographic scale. Now, we looked at counties. Counties are relatively big. We looked at zip codes in Massachusetts using the Massachusetts Cancer Registry and using cancer incidence, which give us higher counts. We found very similar associations that are consistent, again, with the findings at the national level. We looked at site-specific associations, but these were cross-sectional to preserve power, as the count when you aggregate by year, by sex, by age group, and by zip code becomes sparse. We also found a very consistent signal. Then in study 4, we widened the outcome, like all-cause mortality. Are there any other types that are associated with this? And again, we found a similar story. What did this analysis add? It was the first of its kind. To our knowledge, it is the first national US assessment of nuclear power plant proximity and all-cause mortality using continuous proximity metric. It was stress tested with the moving averages of 1 to 15 years, a sensitivity analysis, and to 20 years, and across different inclusion radii. Now, distance-based rather than measured exposure introduces errors in the exposure assessment or proximity assessment, which is more likely to be non-differential measurement error, driving the direction of the association toward the null rather than creating spurious associations. And very recently, a team from South Korea used our same methods for South Korean data, and they replicated the analysis and they found very similar results. The results were very consistent with ours. Now, what does these five studies have in common? As you can see here, study 1 to study 5. 4 of them were in the United States. Study 3 was specifically in Massachusetts because the data, cancer incident data, was at the zip code level in Massachusetts. The spatial units for the first two studies was at the county, study 3 at zip code, study 4 was a county, and in Korea it was at the district level. The outcome, cancer deaths, 3 cancer sites, colon, lung, and breast cancer among female participants. Study 3, cancer incidents. Study 4, all-cause death. And study 5, cancer incidents, South Korea. Then the data sources, the first two were from the CDC, and the third from the Massachusetts Cancer Registry. Study 4 was from the CDC. Study 5 was the Korean Registry. The proximity windows that they tried are different, as you can see here, and all of them, across all of them, the direction was positive. The direction of the association was positive. We see the same spatial gradients study after study, a decline in the modeled relative risk with increasing distance from increasing equivalent distance from a nuclear power plant. Now, what does this all mean? This does not necessarily mean that nuclear power plants are causing these effects or these associations that we see. What this shows, it shows a consistent reproducible spatial association between residential proximity to nuclear power plants and population health outcomes. It held across 4 outcomes, 3 spatial scales, 3 registries, 2 countries, and 2 independent research groups. It survived changes in cutoffs, averaging windows, covariate specification, leave K-out sampling, and these associations were absent in our negative control outcome. What it does not show, it does not show causation. These are ecological designs. Group level associations cannot be read as individual level effects. Not a dose-response relationship either. No radiation measurement enters this work at any point. Not a basis for individual risk. The attributable figures are computed under an assumed causal framework and indicate scale, not preventable deaths. But then why does this deserve attention? These associations are large and more consistent than the current understanding of risks around nuclear power plants would lead us to expect. So with our current understanding or the prevailing hypothesis of how such facilities may cause effects, these associations cannot be explained. This is precisely why they should not be set aside. And an unexplained finding is a reason to investigate, not to conclude. The appropriate response is a sequence of studies that each test a specific hypothesis and build on the last, not one definitive study and not a verdict in either direction. This is the same position that was taken in the 1970s with the landmark paper about the air pollution, which we all know has effects now, and we have policies to protect populations against it. At the time, in the 1970s, it received a lot of criticism because it was a spatial associations that the field could not explain, but they did not dismiss. So what do we think these findings justify next? They justify individual level cohort studies, residential histories, and lifetime exposure trajectories to test whether these associations hold when exposure is assigned to individual rather than areas. Direct exposure assessment, environmental monitoring, dispersion modeling, and facility level release data to test whether, if anything, the distance surrogate is standing for. And broader outcome domains, additional cancer sites, and non-cancer endpoints to test whether the all-cause signal sits and whether the pattern is specific or general. So, in summary, we have 5 studies so far, 4 outcomes, 2 countries, 2 research groups, and 1 consistent spatial association that the current understanding does not readily explain. The finding is not a conclusion, it's a starting point for a line of work, one that narrows the question with each study in the way the field has done before. Thank you. And I can take questions now.
Thank you so much, Dr. Alwadi. So Dr. Alwadi has to leave early in case you missed my announcement before. Please do put questions for him in the chat. I will ask the first question because I think that it's one that for the work that I do is important. Did anything that you run across in any of the databases deal with childhood cancers or diseases? Because I noticed that at least in the first iteration of the 2026 publication, you focused on adults and sometimes more toward the older adult range, which we appreciate. But for children, I just wondered if there was any sort of wisdom that you could impart based on any data that you might have come across. Thank you.
Thank you. This is a question that comes up a lot, especially in the reviews with the paper. So as you can see, these are ecological designs. So what we do is we have counts, number of cases per year at a county level or a zip code level, right? And then we take this down to per age group, per sex, and then per year. So it's per county, per age group, per sex, and per year. And when you take it to this level, the counts at for the childhood or the younger age groups are very sparse, which results in unstable estimates because many of them will be zeros or close to zero. So the rates are unstable. That's why we could not investigate them using such designs or such data. This can be investigated when we go to the next level of investigation. But at this level, with this data, we couldn't study it properly with these methods.
Okay. Okay, thank you for the answer. Does anyone else have a question? Let's see. What was from Amy Sherwood? What was the time allotment for the primary investigation? I think you might have that, but it was very quick. So if you could please repeat.
It was, I believe, three of them were 2000 to 2018. One was 2000 to 2020.
Okay. From Anne Sullentrop, do we know what mechanism that people living near nuclear power plants might receive radiation through? Is it from emissions? Is it discharges in waters? Do we know if it's due to emissions? How would we be able to sort of, I don't know, figure that out?
Well, not at this stage or with these studies, but we have studies planned that will do that as the next level of investigation moves forward. Now, what we checked here is, do people who live closer have higher rates? That's the entire question. If we found, and we did, robust associations that say that, we could then use this in an argument for a proposal so that we can conduct the future studies that test all exposure pathways, association with different exposure pathways to pinpoint how these, or the force behind these observed associations.
And from Doug Bogan, and I know where he's going with this because I've often thought this myself, given that all US nuclear power plants have said they have not exceeded emission limits. I think it's every 3 months or every 4 months, maybe annually. Does this cumulative data suggest that the exposure standards should be revisited or emission limits tightened?
So what this data suggests, so this is an association that cannot be explained with our current understanding of the risk limits around the plants. What these results say is that we need to dig deeper to understand why these exist. We cannot pinpoint yet why they exist. Our current understanding cannot explain them.
Okay, and then Lori Johnson has a question, which I think is a good question and might figure into future study. And that is the role that food originating from the same general place might play. So if there's potential contamination going for food sources, I mean, there's people in their backyard gardens, but there's also, are there farms around here? I know in a place in California, they would graze they would graze cows near the nuclear power reactor, maybe even on the same grounds. And so I think that this is a question that might be for future study, but I would like to have your input on this kind of thought.
So one of the next logical steps to investigate how or what might be the plausible exposure pathway that's driving these associations, if it existed, is that to check if these associations get stronger or cleaner, like with less uncertainty when we see the direction of air, like through dispersion, the direction of how water contamination goes, the direction of how food is transported. Because like if these were due to contaminants leaving the plants, then there might be multiple ways that populations can get exposed. And you need to check one by one the exposure pathways. And this would be one of them, yes.
And I think we'll end with one final question, which is not so much on the science, it's on the blowback from the industry, Department of Energy, NRC, government agencies.
Yeah.
What has been the pushback for the findings in your study?
Well, I get a lot of unhappy emails, very, very unhappy emails. And even the journals get a lot of them, the journals that we publish in, because people who are not happy with our findings are way more motivated to send emails to the journals to tell them how unhappy they are than people who are happy that we are investigating it. They don't get emails telling them we are happy that this group published there. They get emails that tell them that this is wrong and this cannot exist. And one of the major points now I learned to deal with these emails at this point because we're still continuing the research. But one of the biggest conflations that I get with all these emails that is that these associations should not exist under our current understanding. But that's not how science works. Hypotheses are built to explain associations or observations. Observations are not rejected because they do not agree with the prevailing hypotheses. That's backward thinking. And yeah, so
Yes, and we've had trouble with that in the past for epidemiological studies that are not ecologic, but that are case control studies as
well,
well. So you are in good company.
thank you. So the study that I just referred to from the 1970s, they got a lot of pushback too. That they were just economists doing epidemiology. You shouldn't listen to this. It can't exist. But now we have policies against it, right? And there is no accountability for criticism. So whoever criticized them at the time, that's it. They just moved on.
Well, I want you to know, Dr. Alwadi, that we have several people in the chat who greatly appreciate your work. And
Thank
I also greatly appreciate your work. And we want you to continue your work.
you.
And we think what you're doing is extremely important. And we thank you so much for your time tonight and for explaining it. And it was in the weeds and it was detailed. And I'm sure I'm going to go back and watch it several times. But it's delightful to have you here. Thank you so much.
Thank you so much. It's great to hear people liking what we do. Thank
Absolutely. We don't say it enough and we need to. Thank
you
you.
so much. And I wish you a great day. Bye, everyone.
Bye-bye. All right, so we have a speaker that is not able to attend tonight because she is not feeling well. Um, uh, that's Dr. Shanice Forte, and they send their regrets. They are not feeling well. So we will move on now to Diane Dorigo. Diane, if you want to present, the floor is yours.
Thank you. I'm Diane Dorigo, Radioactive Waste Project Director at Nuclear Information and Resource Service. And when I started at NIRS, as Cindy mentioned, it was in 1986. And Carl Z. Morgan, the father of health physics, approached me along with Bob Alvarez and a number of other people who were involved in radiation protection and said to me, Diane, the Nuclear Regulatory Commission is updating its radiation standards, 10 CFR 20, 10 Code of Federal Regulations, and they're doing so many horrible things, and it's completely unjustified. And Carl Morgan would write me handwritten notes. He didn't use the computer, and he would write me handwritten notes and hand done charts showing how the allowable concentrations in radioactive air and water would go up if
Diane,
this rule proceeded.
Diane, share with us who Carl Morgan is for those who may not know.
Oh, Carl Z. Morgan, he is considered the father of health physics. He started at the Oak Ridge Reservation back when the Manhattan Project was starting, and was tasked by the Manhattan Project with setting standards for workers. So he knew, as did Dr. John Goffman and others, from their observation with workers and knowledge of radiation, that it is harmful. This is something that the Nuclear Regulatory Commission right now doesn't really want to admit or admit very much. So I was trying to put in context and some of the people who were on this Zoom were also involved back in the 1980s, challenging the adoption by the US, and I assume the other countries that are also nuclear countries, of the then new radiation standards. And what happened then was that the concept of REMS or millirems was changed from what it had previously been, to one that incorporated estimates of internal dose and external dose together, and we ended up with millirems, effective dose equivalent. And what happened in the US regulations at that time is that 10 CFR 20, the radiation standards, Appendix B. Appendix B has the allowable concentrations of radioactivity in air and water and sewage for the public and for the workers. And the allowable concentrations for 87% of the radionuclides went up. So for 87% of the radionuclides, there could be more radioactivity per millirem. And so they were saying that the public dose was the same and the worker doses were the same, so that this was fine. But in actuality, when we, quote, updated the regs back in 1992 is when it passed, we actually lost. And at that time, during those years, I had thought that I'd extracted commitments from unions to challenge the radiation standards, but when they passed, the unions did not challenge them. And so we have had, since 1992, pretty much the same radiation standards. And now, under the Trump executive orders, executive order, oh my God, Cindy,
14,300.
what is it? 11,
14,
430?
14,300.
11, 4,300, I think. Anyway, Trump executive order directs the Nuclear Regulatory Commission to change the radiation standards. So we've got the Nuclear Regulatory Commission started in the 70s. And so since then, I think it was 74, the Code of Federal Regulations for the Nuclear Regulatory Commission has been evolving, and we have volumes of regulations that have been worked through. We can argue, and we do argue, that those standards are not protective enough, that the allowable risks are higher than the EPA would allow, the 1 in a million to 1 in 10,000. But so there were two main things with the executive orders. One, they wanted to make it easier for the nuclear industry to proceed. They want to make it easier for so-called advanced reactors that are going to be cleaner and safer and better. Well, if these new reactors are going to be so much better than the ones that we already have, why do we have to gut the regulations? Why does the entire code have to be rewritten in several months with very short comment periods, inability? Anyway, the the current reactors are operating under these regs. New reactors apparently seem to be the motivating reason for gutting the regs and increasing doses, making it exempting from environmental regulations, excluding the public from licensing processes, and so forth. There's over 20 different particular rule changes going on, and that's one of the reasons. Okay, the other reason is that in the executive order, it claims that the reason for this change is we want to have gold standard science, as if the science that we have now isn't valid. Well, a lot of us would argue that the linear no threshold model, which the executive order requested be reviewed, is not protective enough, that actually at low doses, the linear no threshold model is one that assumes that for every amount of dose, there is some amount of cancer that is caused. And that as the amount of dose goes up, the number of cancers go up. Well, at the bottom end, the industry likes to say, oh, but at low doses, it's really less danger per unit dose. And what we have evidence of is that it's actually higher danger per unit dose at low doses. But that is not the fight that we're having now. The fight we're having now is whether they're even going to admit that increasing doses cause increases in cancer. And they want to do a threshold below which you don't have to regulate. Below regulatory concern, it was called in the 80s and early 90s. So this rulemaking, 100 and, I don't know, 80 some pages plus supplemental documents, claims that it is not going to do away with the linear no threshold theory. It's going to retain that. In fact, the Nuclear Regulatory Commission was asked to do away with the linear no threshold theory about 10 years ago, and in 2021 made a decision to not reject that linear no threshold model. In fact, yes, as the world says, more radiation causes more cancer. So they claim they're not going to do away with that basis. However, in its cost analysis, its cost benefit analysis, in its rationalization for exemptions and increases and averaging of doses over years, the low doses are considered not significant, even though they're supposed to be considered significant under the linear no threshold. So they're giving lip service to the linear no threshold, but they're not fully respecting it throughout the proposed rule change. So what does the rule do? 1 second here. I am going to my notes that I'm not sharing, but I am going to use. Okay. Well, one of the things that it is proposing to do, and we'll go in and out of talking about it, is to do away with the concept of as low as reasonably achievable. According to the linear no threshold model, the lower the dose, the less radiation. But so therefore, one would try to keep the doses as low as possible. This has been both a concept that helps to protect people, not just in the nuclear reactors or the uranium mines or and mills, but also in our doctor's offices, in our dentist's offices. One of the concerns with the proposal to do away with as low as reasonably achievable is that it will increase allowable doses, or it'll increase doses closer to the limit, stay below it presumably, but that there'd be more radioactive exposures in everybody's life when you go to the dentist, when you go to the doctor, when you get an x-ray, when you in our normal everyday life, but then also in the workplace where the medical providers are, or in the industry where the nuclear workers are, taking away that standard that it's not really a standard, it's a guidance. Taking that away actually has a lot of significant impact, especially in the nuclear weapons complex. And I'm finding out as we're delving into this that in fact that concept has been used to develop some of the other standards that are regulations. The Department of Energy, by the way, on its own, did away with the as low as reasonably achievable several months ago without any fanfare. It was uncovered by a reporter who did release that to the public. But the Nuclear Regulatory Commission is in the process of doing it through its larger rule change and regulatory process. So we've got the claim. Okay, I was starting to say that the claim for justifying having a a new rule and potentially weakening the regulations is that we need to have gold standard science. Well, the science has been showing through the decades that radiation is more harmful per unit dose, more harmful than we thought before. The risk numbers from the National Academy of Sciences Beer 3 were increased when we got to Beer 5, and then when Beer 7 was published, we are now up to 1.17 times 10 to the minus 3. That is a higher risk than the previous. It's 30% higher, 35% higher than in the previous biological effects of ionizing radiation report. So if we're going for gold standards, we wouldn't be reducing protections. Also, and I have asked the Nuclear Regulatory Commission this question, we now know that radiation causes cancer, yes. And then there's some people that, there's women and kids are more susceptible, and I'll talk about that in a second. But also heart disease, reduced immunity, birth defects. Some of the heart disease, in fact, has been shown to be caused by radiation. We know that it reduces immunity. And the current regulations supposedly take into account birth defects in the first 2 generations, but those birth defects could take longer, or the DNA damage could go beyond 2 generations. So if they're going to update to gold standard, you need to really protect the public. Don't just look at cancer, and don't just look at cancer in the standard man, which is what the main standards are still. There's also been associations with neurology and urology problems and other health effects. So if they're going to update to be gold standard protection, they really should do the whole job and don't go into this nitpicky analysis, crazy analysis that's unjustifiable for increased allowable exposures and exemptions and alternative methods of calculation. So the let's see, I thought Janice was going to mention about the National Academy of Sciences, the Institute of Energy and Environmental Research, and Generation Radiation Impact Project have all revealed that women get 50% more cancer at the same dose as men, and that little girls get 7 times more cancer at the same dose as men. So yes, men are injured, and injured badly, can be, by radiation causing cancer, but more kids and more females get cancer and fatal cancers. And we know this. It's been revealed, and yet the standards that are being proposed are not protecting the most vulnerable part of our, not only population, but our life cycle, because the genetic material for all future generations is in the kids. And so if the kids are going to be more damaged, get more cancer, possibly have more damage to their DNA, then we should be protecting that part of our life cycle, not just the workers, which, long ago, that's when Carl Morgan was talking to me. He had been brought in to protect workers at the Oak Ridge plants. So we've got disproportionate impacts. What does the rule do? The current regulations for radiation allow 100 millirems a year from a licensed nuclear facility to the public. At 100 millirems per year, the risk is 1 in 125 of us getting cancer. Workers can get 5 rems or 5,000 millirems a year. 1 in 5 will get cancer if everyone gets that dose at that rate. So the current regs are too weak. But what this regulation proposal does is to do away with ALARA, the as low as reasonably achievable concept. It allows the doses, although they would be the same numbers, to be calculated by alternative methods. And they've put into the rule Appendix H, which is pages and pages of references to documents, International Commission on Radiological Protection, National Radiological Protection Agency Commission, and ANSI, and the American Nuclear Society. Some of those documents you have to pay for even to read them. But anyway, it's basically a black box, and it can be a blank check and a blank box that the licensees, the nuclear operators, can use to calculate the doses that they are giving to the public and to the workers. So this Appendix H is a big loophole, and there's not enough time to even begin in the 45-day comment period to go in and review any of these documents, let alone all of them, and to make comments on them. And what's going to happen if they're adopted is that any licensee can use any of these documents at will to recalculate how the doses are to reassess how the doses are being calculated. And there are several opportunities in this rule for exemptions, both for worker and the public. The nuclear licensee, the nuclear operators, can make a determination that they're going to need to give higher than the legal dose. And they've got a great concept here that I hadn't seen before. It's called, let's see, they're saying it's unused dose. So if you're a worker at a facility and you didn't get your full 5 REMs last year, and this year they need you to do a higher exposure job, well, not only can you have a planned special exposure like it used to be, but they can say, oh, well, we can increase the person's dose because they didn't get a full dose last year. So the concept of unused doses, I have not seen that before, and I think that that needs to be challenged in this rule. There are provisions in existing law for air emissions from nuclear facilities, and right now the EPA's limit is 10 millirems per year to members of the public from air emissions from nuclear facilities. This rule would allow 25 millirems per year, and it would also allow 25 millirems to be absorbed by the workers before their 5 rem dose is even calculated. In other words, they're setting a 25 millirem, I don't know if it's a below concern level, but it's a level that would be, that the dose would be added to, and they wouldn't have to keep track until after 25 millirems. This is for the workers, but it could, I can see that it would easily be transferred to the public and to calculation of higher release levels into air and water. I think I mentioned the caregivers, maybe I didn't. If you've got a family member or a friend that you're taking care of who's been receiving radiation doses, the new rule would let you get not your normal public dose of 100 millirems from a nuclear facility, but I'm gonna just make sure I got this right. Yes, 500 millirems to 2,000 millirems for caregivers. And it would allow more than 100 millirems per year to the public through other mechanisms, prior NRC authorization. It's unclear when the NRC, when the prior request, when the request to the Nuclear Regulatory Commission by the industry, when they get their permission to increase the dose to the public, there's no provision that I can see in the rule that requires notification of the public. So those are some of the ways that I think I should probably stop soon. Those are some of the ways that worker and public doses are being increased, that allowable emissions into air clearly and potentially into air and water could be increased because they're based on the calculation of dose. Let's see if there's anything I've missed here. That's they're doing away with ALARA, allowing a 25 millirem constraint number, which I have a concern could be used as a future below regulatory concern number. And so we've got still a little under 2 weeks to get together more specifics and citations on the things that I'm sharing with you today. So we hope that people will go ahead and comment often to the NRC on any aspect of this rule that moves you. And I would also invite others. There are many people in this group today who've been delving into the rule. Also, please jump in on anything I've missed or correct anything that I may have misinterpreted, and just keep on commenting. And there's two ways to comment: one through federal regulations, through regulations.gov, and through federalregister.gov.
Okay, Diane, thank you so much for that. So I want to update everyone before we get to questions, but I will say if you have a question, put it in the chat. It can be on process as well as in the weeds. So please don't be shy. I know this group isn't shy. And I put in the chat the searchable version of the proposed rule link. Alfred put in the chat the Protect Better webinar #1 video if you want to watch that recording. And we will now get to questions. And before we get to questions, though, I want to just say for this group, yes, this is in the weeds. It's supposed to be in the weeds. It's supposed to be technical, but that doesn't mean your comments have to be that or just that, right? There are a lot of procedural questions here about how they've handled this proposed rule from the time they announced it to the time that they didn't give us extensions, to the time that they seem to just be ramming this through without a lot of thought. And so it's important to not just talk about the technical bits, because they really do seem to be motivated to do this. Okay, so let's get to questions.
And it is Executive Order, thank you, Lee from Snake River. It's Executive Order 14300. And I'm pretty sure this is NRC 2025-1400 for this rulemaking.
So the first question is, will this rule require guidance to set threshold dose levels? If so, has this guidance been issued?
Let's see.
Do you want me to say that again?
Well, I heard it, but I'm not quite sure what the person means by threshold levels.
Let's see if we can talk to the person. Was it to look through? I mean, I'm thinking that what they mean by threshold is, yeah, I mean, for this rule, it could be anything. I mean, I would think that they mean exposure levels. Has there been an actual number set? It's Richard Miller who asked this.
Can you unmute?
I can't.
Okay.
Well, sure. Maybe.
Oh, there he is.
There you go.
So there's a call for guidance in the rule. So, and the guidance seems to imply that it will be issued in order to look at various exposure thresholds, is the inference, as under what they call a graded approach. So yeah. I'm not sure what that all implies. Can you decode that into English?
It's irritated me throughout the 40 days or so that we've been looking at this of what is this graded approach. They're claiming that instead of uh, just have, let's see, not really. I think what it means is that they're trying to, they'll do away with ALARA, which was the concept of keeping it as low as possible. And they're replacing it with a graded approach, which is supposedly some kind of constraints, which they're saying used to be a 10, and now they're going to go up to 25 millirems per year. And as they're trying to put mechanisms in place that as you get closer to meeting the dose, they would take measures to try to reduce the exposure so that people don't end up getting the dose. This is mainly a workplace thing. But I don't know what those measures are. And maybe in the union webinar that's happening on the 25th, maybe they might be able to clarify that there.
I mean, it's also partly a legal question, because if you're going to go forward with a rulemaking that's dependent on guidance, and the guidance is going to be actually what gets implemented, and you're sort of left commenting on a blank check.
You were breaking up. Do you want to try saying that again?
That was Lexi speaking.
Oh.
He's saying, oh, go ahead.
No, it's fine. The only question is if you've got a rule and it's saying in the preamble at least, okay, there's going to be guidance, and the guidance is going to control this graded approach, and the graded approach is going to determine what kind of dose you can get under what circumstances, and it hasn't been issued. And the legal question is, you can't comment on something you haven't seen. So the comment period ends, then the guidance comes out, and the question is, you're writing a blank check for the agency to put out its own guidance, for which there's no opportunity for notice and comment.
Oh, so what you're saying is that, see, there are guidance documents now, and I've tried to get into one of them. I haven't gotten into the other one. And so what you're saying is that there are future guidance documents that aren't even out yet, or that we haven't had an opportunity to really review because they won't give us an extension. And so this is potentially something to sue over. I mean, the goal here is that we know that the NRC is going to come out with something we don't like. And the goal here is that everybody will get in as much comment on every aspect of it, so that when we finally get together, the lawyers to challenge the final rule, whatever it is, that we've got the concerns already listed in the record that can be used to go to court. That's the way it works. If you everything we put into the record before the August 31st deadline is fodder that we can use to challenge the rule.
Okay. We have a specific request for a document. Can the article regarding the DOE abandoning ALARA be shared? I think that's an easy
I put that in the chat already. I put the NPR article in the chat. And I will put the second one.
Oh, the
DOE
abandoning ALARA. Oh, sorry.
Yes.
Okay. Yes, I misheard as NRC.
Right.
Okay. Yeah, this was a National Public Radio report a few months ago. Thanks, okay. Lexi.
Yes, thanks, Lexi. And I put a link in, since people in the chat were clamoring for it, sample comments, letters, a video on how to submit, and talking points are on the link that I posted in the chat. You have to scroll down the page. There's talking points on the right, and there's sort of a how-to guide on the left as you're facing the page. And then there's also a video that shows you how to submit comments if there's an issue.
And this is on protectbetter.org?
Yes, protectbetter.org.
It's also on committeetobridgethegap.org. I believe they have something similar.
Yeah, so Catherine Skopik asks, how are these NRC changes in radiation levels being made known to the entire public at large, not just specifically focused citizens, so the public knows what they are potentially being exposed?
Not.
They're not. All
They're
together,
not.
they're not. Yeah.
I mean, whatever amount of screaming and yelling we can do, that's it.
Yeah. Yeah. And there were also a couple of people that were asking sort of, or commenting sort of on the same thing. And that was, why are they doing this? What is it for? Is it for AI data centers, et cetera, et cetera? And actually, I have to say this because this occurred to me this morning. I actually think one of the things that they're doing is putting out this rule because it is a very deregulatory rule, and they say deregulatory. They use the word deregulation or deregulatory in the rule itself. So they're admitting that it is a deregulatory structure. And I'm thinking that what they want to do with it is they want to allow private energy sources, not public utilities, but private energy sources on these oligarchs' lands for AI data centers or whatever else they want, their little islands off to wherever, and so that they can say that they're regulating them when they're actually not. So that's one of the things that occurred to me is I'm not sure that this is actually for public energy use. I think that this is more for private construction of these facilities. So that was kind of a comment and slash question that people were having. There's something here. Oh, Diane, can you explain, people might see this, the difference between exemption and variance? Can we talk about that a little bit? Because I think that this is an important sort of thing to broach.
Can you do it?
Language. No, I want you to do it. The language. I mean, if you're okay doing it.
I don't know.
Okay. Well,
somebody, but there's a lot of people on this call, I mean, on this Zoom, who've read this rule. Is that something anyone can share?
We don't have to do it right this instant, but it would be, because see, what I think that they're doing, let me just tell you really quickly. I think that it's kind of the same thing. And they want to be able to say, it's not an exemption, it's a variance. But to my mind, I'm not sure logistically, like when push comes to shove, exactly what the difference is. I think it's kind of the same thing, but that's my opinion. I don't know if anybody wants to pipe in on that, they can raise their hand. Sarah Fields asks or ponders, I wonder how NRC agreement states are responding to these proposed rules.
I hope that they are. I haven't seen comments in the Federal Register. When you go to the Federal Register, you're able, or regulations.gov, you can see the comments that have already been submitted. And I know that the Conference of Radiation Control Program Directors got its extension request denied. I will hope that states will be watching it. And then there are associations, Organization of Agreement States, Louisville Radioactive Waste Forum, those groups. So I will be watching for what comments they put in on this.
Okay.
And they should be concerned because some states already have more protective standards. And if the NRC exempts or varies, or makes a change, then agreement states are going to have to adopt the changes for radiation standards, most of them verbatim. Agreement states are states that regulate nuclear activities, license nuclear activities in their state, and their regulations have to be adequate and compatible with the federal regulations. And especially with regard to radiation, they make them be as close as possible or verbatim. Some of the other rules can have a little more variability, and states can do things a little differently. But on the radiation standards, I hope that states will review them anyway. I'm not sure that they're, I'm just not sure how many have been able to get added in the short time period.
Right. So Renee has a very interesting comment in here on how the Canadian Nuclear Safety Commission uses the term graded approach. They use it to mean that they vary the approach based on the level of risk they have guesstimated to be in play. they talk about a graded approach versus a prescriptive approach. Basically, how it plays out is that a graded approach is more flexible, kind of a judgment call rather than a numbers-based rule. And I find that this is interesting because one of the whole purposes of this rule that they gave for instituting it or attempting to institute it is to give clarity to the regulatory regime. But when they're talking about a graded approach being more flexible, I'm not sure that that actually gives clarity. It might give the industry an out, but it certainly doesn't give clarity to what the public is going to be exposed to, or indeed for a process point, how the public knows that any of these individual sites are going to decide that they want a variance. I'm not sure. It doesn't seem to be in the rule, any of these processes. Dee, I don't know if you wanted to speak to the process of how the public might engage on that issue.
No, I think we should just take, go on.
Can you comment on categorical exclusions outside of regulation? Is this going to affect radiation exposure?
Categorical exclusions, there have actually been a couple of at least one rulemaking on categorical exclusions to allow exemptions, exclusions from the regulations. It's one of the more frustrating issues, and I think we should just do a separate webinar on that. I would draw, for those of us who are concerned about the old below regulatory concern, deregulating wastes and materials, there is a rulemaking coming up at the end of August. You can see all of the rulemakings on the NRC wholesale regulation revisions page. If you go to nrc.gov, or if you Google wholesale NRC regulations, you come to this page and it lists all the rule changes. So there's one that's coming up at the end of the month. It's going to be adopted as a final rule with no comment period, but we can comment anyway. And it's called exemptions from materials licensing. So to me, that sounds like it's going to be a way to do away with it, to allow some materials to not be regulated. And we're going to have to comment on that. It's hard to comment on these, to do big alerts, because you have to go through the process of putting your name in, and, you can't just blast a bunch of comments, and you got to go in and individually do comments.
Next question. How will loosening radiation limits affect cleanup of contaminated sites? Will irradiated metals and other materials be released to the public to be reused? How will transport of radioactive substances be affected?
There is a transport section in here. There's also a transport rule. Okay, let's see, you want to know, could you say that one more time?
Hold on. Yeah. How will loosening radiation limits affect cleanup of contaminated sites?
Okay, so wait, let's just do that. So right now we've got the Nuclear Regulatory Commission regulations have a provision for license termination, section 5 of the section E of the 10 CFR 20. And it looks like those numbers remain the same for NRC facilities that are going to terminate their license. But if the allowable levels for contamination go up, it's a bad precedent for the other agencies that have responsibility for cleaning up Superfund sites or for cleaning up other radioactively contaminated sites. Okay. And was the rest after cleanup?
It was metals. So let me go. Will irradiated metals and other materials be
okay, so the Department of Energy also in 2025, unbeknownst to many of us, decided that it would reverse the ban that it had when, let's see, I think it was under the Clinton administration and Richardson was the Secretary of Energy. the Department of Energy self-imposed. They said, we are going to ban the release of metal that's radioactive throughout. Volumetrically contaminated metal cannot go out into the marketplace or recycling or regular garbage. They also have had a moratorium on any metal from radioactive areas of the Department of Energy, because radioactive areas of the Department of Energy, inevitably, most things are radioactive in those areas. And so rather than fight over what's the clearance level, the rule was made that no metal could be released from radioactive areas into regular garbage and recycling. This ban has been reversed, and I'm trying to figure out whether the DOE has started implementing it for the Department of Energy sites around the country. It's a big battle that we fought for decades, and this would be our first major loss on it. And I think we need to, go after that as well. We will, have to delve into the DOE implementation of that.
Yeah. How will these loosened radioactive limits affect sick nuclear workers getting compensation?
Oh, that's interesting.
Yeah, that's a really good question, isn't it? I'm getting the full range of what that might mean, especially go by doses. Do they not, by exposures, or do they?
That is a really good one, because the RECA, the Radiation Exposure Compensation Act, it doesn't matter what your dose was. If you were downwind, or you were a uranium worker during those years, you get some amount of compensation. It's probably not nearly enough to cover even your medical expenses, but it's something. And then with regard to, if the legal levels go, theoretically, if the legal levels go up, or if the ability to prove that the levels have been exceeded become more complicated by implementing not just the normal, they currently use ICRP, International Commission on Radiological Protection, 26 and 30 to calculate doses. Now what they're saying is you can use any of this whole Appendix H of references to calculate your doses. So you might have a much harder time showing what the dose is and that it's been exceeded.
Yeah. Can you go over how these proposals could affect the cleanup of the DOE portion of the Santa Susana field lab?
Well, I don't
this
believe, I could be wrong on this. Jenny, are you asking it, or maybe you can help me with it? I don't believe that the NRC regulates that site. I believe that it's EPA and DOE. So I think any weakening in standards or precedent being set for making it more difficult to implement or enabling deregulation is a clear precedent that then will be used across the board by all of the other agencies. I'm sorry, I can't give you a clearer answer on that.
I can't. I didn't ask the question. This is Jenny. I didn't ask the question, but DTSC, the state regulator, is the regulator over DOE.
Oh, so they have agreement state standards with the NRC.
So DOE is already falling back and denying the LNT, refusing to talk about it and saying that the cleanup isn't feasible. So I'm assuming that yes, these in any way possible that DOE can get out of that cleanup, they will attempt.
Of course.
Yeah.
They already have. So yeah, I guess it's an interesting thing is if you've got state facilities that are state licensed and regulated or have some amount of state authority, if the NRC changes its radiation regs, the rule is that within something like 3 years, the states have to adopt these same standards, and they have to do them, they have different levels of how verbatim they have to be. But yeah, so if the NRC weakens things, and then the state of California weakens things, that will impact the facilities in California. Yes.
How will these loosened radioactive limits? Oh, we already did that one. Sorry. So there was a question that was a follow-up question, and it's a legal question. So if you don't quite feel comfortable answering it, let me know. But if you ask the NRC now, and then this happens, and this that they're talking about is the deregulation, the below regulatory concern, the recycled metals from that question that you had, it was a couple of questions. Does that give more grounds for legal action later, or does it give the NRC time to prepare by legalizing these practices?
What's the question?
What this question is it's following up on the BRC question, and it's a legal question. It's a question about what kind of legal standing, I guess, we might have if the NRC does some of this below regulatory concern stuff, or recycles metals, or transports, or whatever. There are a series of things that the question
Okay,
asks.
so there are 14 states that have had stricter regulations on what could be cleared. There are 11 or 12 that actually have laws that require continued nuclear regulatory control over nuclear waste in their state, even if the feds or other states deregulate it. So I am hoping that some of those states will assert their own authority, and it could be a question because those laws were passed in the late 80s and early 90s based on authorities that states have to have a need for power and land use planning and other aspects that are not preempted. So the state laws are passed, and a question is whether what's in this rule, and I'm not clear on that, but I do have a suspicion for the upcoming rule that I mentioned that's coming up at the end, the exemptions from materials licensing. I think that one's going to be blatantly releasing radioactive materials. So the question is there a legal fight there if the states take it up? I mean, these laws were passed in the 80s and 90s. I don't know how many state officials or attorneys general even know that they have those laws. But I would be glad to work with people. I'm trying to get notification to those states, but it's not going to happen before August 31st for all of them.
So question, what has been done to engage the unions in this campaign?
Well, I think the unions have jumped on it themselves. Their workers are impacted, and I know that they're having a webinar on the 25th. And I know that Tony Webb, who's on this call from Australia, who knows what time it is there. Or maybe it's an okay time right now. It's starting to be daytime there. Anyway, has worked with unions, and so I'm hoping that unions will assert their authority to protect their workers and prevent weakening.
Okay.
I don't know if Richard's still on it because he has had some contact with unions. Richard, do you want to say anything else about that, or Tony? I think they can just unmute, right?
Yeah.
Or do you have to
I'm
unmute?
happy. I mean, just briefly, I think the steelworkers have passed an internal resolution that calls on
Which includes the nuclear workers now, steel workers, includes the nuclear.
Right. They merged with the old oil, chemical, and atomic workers. And they've passed a resolution to focus on defeating this particular rule, the one that we're discussing today, on occupational exposure basis. And I think they're pretty concerned about the rollback of ALARA because the union had historically fought for the adoption of ALARA going all the way back to the 1960s when a guy named Tony Mazzocchi, who some of you know, fought to get ALARA in the first collective bargaining agreement at Silcor on Long Island, which made thorium and uranium fuel rods. And so it's been a longstanding adopted issue for the nuclear sector of the union to go and defend ALARA. So, and I think their webinar that's coming up next week will have David Richardson, who did the in-work study, which is the meta study on atomic workers in France, Britain, and the United States, and Mark Griffin, who's a health physicist, to try to wrap their minds around, from a rank and file point of view, getting ready to lobby this issue. And I think their strategy will be, once comments are submitted, to go to the Hill and seek a rider, assuming the House flips, which is a big assumption, but if the House flips, to seek a rider on the Energy and Water Appropriations Bill to block this part of the rule. So that's their larger strategy, is to.
So they're just focusing on the occupational part.
Yeah, right now. I mean, that's a big bite for them. So that's, I think, what their agenda is and where they're leading towards over the next few months.
Tony, did you wish to say something? You have your hand raised. Tony Webb. There you go.
Just very briefly, the Australian Council of Trade Unions has picked this issue up here in Australia in terms of the potential effects for workers involved with the nuclear submarines that we're supposed to be getting sometime from you guys. But they've also taken the initiative of raising it with the AFL-CIO in the States, the Canadian Labour Congress in Canada, and the Trade Union Congress in Britain. So that the union movement is very definitely aware that this whole issue of Trump's directive and the NRC response has a potential to affect workers worldwide. We're at a time when we know that the evidence is now in for a need to reduce the overall exposure limit to workers at a time when the US is basically digging in on its standards that allow much higher levels of exposure than anywhere else. But the major concern that we have is with the change in the ALARA principle, that workers below 500 millirem would no longer be monitored. Now, how the hell do you know when a worker has gone over that limit if you're not monitoring them? And how do we have studies that confirm the work that's already been done in terms of the in-works studies looking at the effect on workers if you don't have those doses on record? So what the NRC proposals are doing is basically taking out of the monitoring system a whole range of workers who are actually exposed in the range where most workers are currently getting their doses, in that 1 to 5 millisievert or 100 to 500 millirem range.
Thank you for your comments. I wanted to let everyone know that we are dealing with the proposed rule from NRC, but that proposed rule has an underlying document. And I think that this underlying document says the quiet part out loud and gives some guidance into what they're actually doing in a way that doesn't make one's eyes cross too badly. So I put that link in the chat. The name of the document is Draft Regulatory Analysis for the Proposed Rule Reforming and Modernizing the NRC's Radiation Protection Framework. So it's the Draft Regulatory Analysis, and you have the number there for the document. You have the link. I think it's worth, if you want to continue in the weeds, I think it's worth looking at this document, and actually maybe some stuff will be clarified for you if you do. Let's see. So we have one question. We are at 8:27. So let's take one more question because I think it's going to be kind of a simple answer. And then I want to turn it back over to Alfred for telling people how to comment and giving links and stuff. So Diane, in New York State, our agreement with DECOM, decontamination company Horrible Holtec, I like the alliteration, for Indian Point is 10 rems for cleanup. Will that hold?
10 rems?
Yeah, that's what this
10
says.
milliwatt. Wait a minute. What is this?
It is in
The-
chat.
The cleanup standard is 25 millirems a year for a closed facility. Are you sure you're not?
Sorry, I mean millirems, but our agreement is 10 and NRC is 25. And
Right.
DEC was saying we had to match NRC, which we don't. So what's going to happen to say our cleanup, which is an agreement? There's a written agreement about it.
Sounds like New York has to fight to keep it.
Yeah.
Thank you.
I don't think the numbers in the cleanup, in the license termination are changing. It's still 25. And if you can't meet that, you zap people with 100. And if you can't make that, you go to 500. And supposedly down the pike, somebody's making sure that it doesn't exceed 500. That's what our cleanup standards are. So the standard that has been agreed at Indian Point needs to be maintained.
Yes, and I just actually, there's stuff in the chat about uranium mines and mills. Uranium mines are regulated by the Mine Safety and Health Administration. Thank you, Sarah, for that. The NRC does not regulate that, but they do regulate uranium milling. And so I think that both Richard and Sarah answered the question on will this rule impact uranium uranium industry facilities. So it looks like there's a bifurcation there. Are we saving the chat? Sorry that I don't know that answer off the top.
I am currently scanning all of the links into a place where we can save them. And I will figure out how to save the chat.
Thank you, Lexi. So we are going to save the chat. Alfred, do you want to take us out with the comments slide? Lexi, can you put the comments slide up? Thank you, Diane. Did you have one last thing to say, Diane?
Nope.
Okay. All right. So thank you all very much. To all of our speakers, we really appreciate your participation, and thanks again to Heal Utah for the technical hosting. We will get you the recording and the chat notes sometime next week. Here is Alfred again. Alfred, are you ready, or should I take them out with the slide?
I'm all set. I want to thank everyone for attending the webinar tonight, and for our speakers and the hosts, Heal Utah. All this talk about uncertainty and what we know and don't know makes me think of the precautionary principle. If you don't know what the real answer is, be careful, because with radiation, once it's released into the environment, you can't call it back. It's a one-way street. So this is why I really want to encourage people to make sure that you send in at least one comment. You can send in many comments. Get your friends, your family members to also make comments. We're trying to flood the zone of the NRC, telling them that we're unhappy with this. Go to protectbetter.org. There's all sorts of information there. There's a button that says take action, and it'll walk you through how to actually make a comment. That you can go either to, there's one button that takes you to the page on regulation.gov, or a different button on federalregister.gov. They're quite similar. Some people like one, some people like the other. Use them both, but just make comments, get other people to make comments. We're really trying to go viral, and we need your help to do this. Send out emails to your friends. I think you can easily characterize this as not about pro or anti-nuclear. This is about protecting public health and the genome of human beings. So I just encourage you to tell your own story as simply or complexly as you want to, but just make sure you send in lots of comments and get other people to do so. Thanks so much for attending this webinar.
Thank you, everyone. Hope to see you at the next one on Wednesday next week.
Thank you all.